Last year, I sat down with a 71-year-old man whose triglyceride numbers had reached 580. He had been on a statin for 4 years. 4 years of taking a pill every single morning. And his numbers were still climbing. He was not lazy. He was not ignoring his health. He was doing everything his doctors had told him to do. And yet there he was, sitting across from me, frustrated and frightened, holding a lab report that told a story nobody had bothered to translate for him. Here is what nobody told him. And what I'm going to tell you today. The answer was sitting in his kitchen the entire time. 5 simple foods. No prescription required, no side effects, no pharmacy copay, just food. Working exactly the way food was always designed to work. Stay with me, because by the end of this video, you will know exactly what to do. Starting tonight. Let me tell you something that doctors do not always have time to explain in a 15-minute appointment. After 60, your blood fat does not rise simply because of what you ate last Tuesday. Something deeper is happening. Inside your liver, inside your bloodstream, inside the very system that is supposed to keep everything in balance. Think of your blood like a river. When you are young, that river runs clean and clear. The current is strong. Everything moves the way it should. But when triglycerides are high, it is like pouring oil into that river. The water thickens. The current slows. The heart has to push harder just to keep everything moving. And the arterial walls, the banks of that river, start collecting deposits that were never supposed to be there. That is not a metaphor I use to frighten you. It is what I have watched happen in real patients over 15 years of internal medicine. I have reviewed the lab work. I have tracked the progression. And I have sat with patients who came to me on 3, 4, 5 medications wondering why nothing was working. My name is Dr. Marcus T. Thorne. I am an internal medicine physician at CMC, and today I am going to show you 5 foods that address blood fat at the source, not by masking the numbers, but by changing the biological environment that produces them in the first place. But before we get to the 5 foods, I need you to understand one thing, because without this, nothing else in this video will make complete sense. High triglycerides are not just a fat problem, they are a liver problem. Here is what actually happens. Your liver is the central processing unit for everything you eat. It takes in carbohydrates, fats, proteins, and decides what to do with them. When you consistently eat more refined carbohydrates and sugar than your body can immediately use for energy, your liver converts that excess into triglycerides, fat particles, and releases them into your bloodstream. Your triglyceride number on a blood test is essentially a report on how well your liver is managing that daily workload. And here is what changes specifically after 60. Your liver's processing speed slows. Insulin sensitivity in liver cells decreases. The system that is supposed to clear triglycerides from the bloodstream becomes less efficient. The same diet that produced acceptable numbers at 50 can produce dangerous numbers at 65. Not because you changed anything, because your liver did. Every meal you eat 3 times a day is either helping your liver manage that workload or adding to it. That is the whole game. And the 5 foods I'm about to show you all work through that same fundamental mechanism. They give your liver better tools to do its job. Now drop your state in the comments right now and tell me, when was the last time your doctor explained what your triglyceride number actually means? A few years ago? Never? I want to know. Because that answer tells me a great deal about what kind of information is actually reaching people who need it. Food number 1, oats. And I want to spend real time here because the mechanism behind this one is genuinely remarkable and almost nobody explains it correctly. Oats contain a specific type of soluble fiber called beta-glucan. And beta-glucan does something in your digestive system that no medication currently on the market fully replicates. When beta-glucan reaches your gut, it absorbs water and forms a thick viscous gel. That gel physically binds to bile acids in your intestine, the same bile acids your liver produces from cholesterol and triglycerides to help digest fat. Under normal circumstances, about 95% of those bile acids get reabsorbed in your lower intestine and recycled back to the liver. Your liver uses them again. The cycle repeats. Beta-glucan interrupts that cycle. It traps bile acids in the gel and carries them out of your body through excretion. Your liver now has a deficit. It needs to produce new bile acids to replace what was lost. And to do that, it pulls cholesterol and fat from your bloodstream. Your circulating triglycerides drop. Your LDL drops. Your liver is essentially doing a clearing operation every single morning. The FDA has approved a specific health claim for beta-glucan and cardiovascular risk reduction, one of the very few food-based claims that has met their evidentiary standard. That is not a trivial threshold to cross. Research suggests that 3 to 4 grams of beta-glucan daily, which is roughly 1.5 cups of cooked rolled oats, produces measurable reductions in triglycerides and LDL in most adults within 6 to 8 weeks. I had a patient, James, 66, from Atlanta, Georgia, retired school principal. His triglycerides were at 420 when he first came to see me. His cardiologist had discussed starting a second medication. James asked me if there was anything he could do with his diet first before adding another pill. We started with oats every single morning. Rolled oats, not instant, because the processing reduces the beta-glucan content significantly, with 2 tablespoons of ground flaxseed stirred in. Nothing else changed in his diet for the first 8 weeks. His follow-up labs showed triglycerides at 280, 140 points lower. His cardiologist delayed the medication conversation entirely. James told me it was the first time in 3 years he had left a doctor's appointment feeling like he had some control over his own numbers. What to do? Every morning, 1.5 cups of cooked rolled oats. Add 2 tablespoons of ground flaxseed, not whole ground, because whole flaxseed passes through largely undigested. Add a small handful of walnuts. You are stacking 3 of the 5 foods in this video into a single breakfast. The compound effect begins immediately. Food number 2, fatty fish. And the mechanism here goes deeper than most people have ever been told. Salmon, sardines, mackerel, herring. These fish contain long-chain omega-3 fatty acids, specifically EPA and DHA. And these 2 compounds act on triglyceride metabolism through a pathway that has been studied more rigorously than almost any other nutritional intervention in cardiovascular medicine. Here is the mechanism. EPA and DHA directly suppress your liver's production of VLDL, very low-density lipoprotein. VLDL is the primary vehicle your liver uses to transport triglycerides into the bloodstream. Less VLDL production means fewer triglycerides entering circulation. At the same time, omega-3 fatty acids upregulate lipoprotein lipase, an enzyme that breaks down triglycerides already circulating in the blood. You are simultaneously reducing how much your liver releases and accelerating how fast your body clears what is already there. A meta-analysis published in the Journal of Clinical Lipidology reviewed over 70 randomized controlled trials and found that omega-3 supplementation reduced triglycerides by an average of 20 to 30% in adults with elevated levels. That is a reduction comparable to some prescription medications, achieved through food. And here is the detail most people miss entirely. Sardines and mackerel produce the same omega-3 effect as salmon at a fraction of the cost. A can of sardines and olive oil costs less than $2 and delivers 3 to 4 grams of combined EPA and DHA. That is a therapeutically meaningful dose in a can you can open with your hands. I had a patient, Dorothy, 69, from Memphis, Tennessee. She had been avoiding fish for years because she believed it was expensive and difficult to prepare. Her triglycerides were at 390. We had a very simple conversation. I told her that 2 cans of sardines per week and 1 fresh salmon meal per week was not a culinary transformation. It was a medical protocol that happened to involve food. She laughed at that. 8 weeks later, her triglycerides were at 260. Her response when she saw the number was, "That is it? Just the fish?" What to do? 2 to 3 servings of fatty fish per week. Salmon, sardines, mackerel, herring, any of these. If you are using canned fish, choose options packed in water or olive oil rather than vegetable oil. If you genuinely cannot tolerate fish, a high-quality omega-3 supplement providing at least 2 grams of combined EPA and DHA daily is a reasonable alternative. But food first. Always food first. Have you ever been told to eat more fish for your triglycerides? Write yes or no in the comments. I want to know how often this conversation is actually happening in doctors' offices because based on what I hear from patients, it is not happening nearly enough. Food number 3, extra virgin olive oil. And this one requires me to correct something that has caused real harm for decades. For 30 years, people over 60 were told to reduce fat. All fat. Low-fat diets, low-fat products, low-fat everything. The logic seemed sound. Fat in the diet equals fat in the blood. Remove one and the other follows. The research, when it finally came in at scale, told a completely different story. Dietary fat does not simply become blood fat. The conversion is far more complex than that, and the type of fat matters enormously. Replacing saturated fat with refined carbohydrates, which is what the low-fat movement produced in practice, actually raises triglycerides by giving the liver more sugar to convert, the opposite of the intended effect. Extra virgin olive oil contains 2 compounds that are directly relevant to blood fat management. The first is oleic acid, a monounsaturated fat that improves insulin sensitivity in liver cells, reducing the signal that tells your liver to produce more triglycerides. The second is oleocanthal, a natural anti-inflammatory compound that acts on the same pathway as ibuprofen, reducing the chronic vascular inflammation that accelerates arterial damage in people with elevated blood fat. Multiple studies from the PREDIME trial, one of the largest cardiovascular nutrition studies ever conducted, found that a Mediterranean diet centered on extra virgin olive oil significantly reduced cardiovascular events, improved lipid profiles, and reduced inflammatory markers compared to both low-fat diets and standard care. The practical application is direct. Replace every refined vegetable oil in your kitchen, canola, soybean, corn, sunflower, with extra virgin olive oil. These refined seed oils are extremely high in omega-6 fatty acids. For most of human history, humans consumed roughly equal amounts of omega-3 and omega-6. Today, the average person consumes 15 to 20 times more omega-6 than omega-3. That extreme imbalance drives chronic systemic inflammation, the slow, silent, low-grade fire burning inside your blood vessel walls that stiffens arteries and raises cardiovascular risk year after year. Every time you cook with canola or soybean oil, you are adding fuel to that fire. Every time you use extra virgin olive oil, you are doing the opposite. I had a patient, Robert, 72, from Charlotte, North Carolina. He had been cooking with vegetable oil his entire adult life because he had been told it was heart healthy, his triglycerides were at 340, and his inflammatory markers were consistently elevated. We made one change: olive oil for everything. Same foods, same portions, same medications. 3 months later, his triglycerides were at 245. His C-reactive protein, a marker of systemic inflammation, had dropped by 40%. He said, "I changed nothing except the oil." How is that even possible? The answer is that the oil was not a neutral vehicle. It was an active participant in his inflammation every single day. What to do? Go to your kitchen today. Look at what oils you have. When the refined vegetable oil runs out, replace it with extra virgin olive oil, and do not buy the refined oils again. For higher heat cooking, real butter from grass-fed cows is a significantly better option than margarine or seed oils. Use olive oil for everything else: cooking, dressing, drizzling. 2 to 3 tablespoons per day is a therapeutically relevant amount. Food number 4, ground flaxseed. And this is the food on this list that I find myself recommending most consistently because it addresses blood fat through 3 separate mechanisms simultaneously. Flaxseed contains alpha-linolenic acid, a plant-based omega-3 fatty acid. It contains lignans, phytoestrogens, with documented anti-inflammatory and cholesterol-modulating properties, and it contains soluble fiber that works through the same bile acid-binding mechanism we discussed with oats. 3 pathways, 1 food, 2 tablespoons per day. A study published in Nutrition Research found that daily flaxseed consumption reduced triglycerides by an average of 12% and LDL by 15% over 12 weeks in adults with elevated lipid levels. Those numbers represent a meaningful shift. Not a dramatic overnight correction, but a steady, consistent, compounding reduction that accumulates over months. The critical detail: it must be ground flaxseed, not whole. Whole flax seeds pass through the digestive system largely intact. The outer hull is essentially indigestible by human enzymes. Ground flaxseed, either pre-ground or freshly ground in a small coffee grinder, delivers the omega-3, the lignans, and the fiber in bioavailable form. I had a patient, William, 63, from Baltimore, Maryland. He came to me asking specifically about natural approaches to blood fat management. He was philosophically opposed to starting another medication and wanted to exhaust every dietary option first. I gave him one instruction for the first month: 2 tablespoons of ground flaxseed every morning in his oatmeal. Nothing else changed. His triglycerides dropped from 310 to 245 in 8 weeks. Not because ground flaxseed is magic, because 2 tablespoons every morning is a consistent compounding intervention that his body responded to the way bodies are designed to respond when given the right inputs. What to do? 2 tablespoons of ground flaxseed daily. Stir into oatmeal. Add to yogurt. Mix into a smoothie. The flavor is mild and nutty, and it disappears into almost anything. Store ground flaxseed in the refrigerator or freezer, because the omega-3 content oxidizes quickly at room temperature. Buy whole flax seeds and grind them fresh in small batches if possible. Maximum nutritional potency and 0 waste. Food number 5, walnuts. And I want to close with this one because it may be the most versatile and most underestimated food on this entire list. 30 grams of walnuts daily, roughly 14 halves, a small closed fist, has been studied more extensively for cardiovascular benefit than almost any other single food. And the findings are remarkably consistent across populations, age groups, and study designs. Walnuts are uniquely high in alpha-linolenic acid among all tree nuts, more than almonds, more than pecans, more than cashews. They also contain L-arginine, an amino acid that your blood vessel walls use to produce nitric oxide, your body's natural vasodilator, the compound that tells your arteries to relax and open. And they contain a specific polyphenol called elagitannins that gut bacteria convert into compounds with documented anti-inflammatory effects on the cardiovascular system. A comprehensive review published in the American Journal of Clinical Nutrition, analyzing 26 controlled trials, found that walnut consumption significantly reduced total cholesterol, LDL cholesterol, and triglycerides across all populations studied, with the effect size increasing in adults with higher baseline lipid levels, meaning the people who need it most tend to benefit the most. I had a patient, Marcus Sr., 74, from Detroit, Michigan, a retired auto worker who had never been a snacker. He found the idea of eating nuts every day slightly odd. He associated snacking with weight gain, not health management. I explained the mechanism, I explained the research, and I gave him one instruction. Every day at the same time, mid-afternoon, 14 walnut halves. That is it. No other changes for the first 6 weeks. His triglycerides at the start were 350. At 6 weeks, 290. At 3 months, 241. He told me at that appointment, "I thought you were humoring me with the walnuts." I did not think something that simple could do something that real. That response is something I have heard versions of more times than I can count. What to do? 30 grams of walnuts daily. Mid-afternoon works well for most people because it blunts the blood sugar drop that often leads to poor food choices before dinner. You can also add them to your morning oatmeal alongside the ground flaxseed, or eat them before bed, because walnuts also contain melatonin, and the L-arginine they provide supports the natural nighttime drop in blood pressure that your cardiovascular system depends on. Now I need to stop for a moment, because I can already predict what some of you are thinking. This sounds too simple. If it really worked this well, my doctor would have told me. I understand that reaction completely. I had a version of it myself early in my career. Here is what 15 years of internal medicine has taught me about that instinct. The most powerful interventions are almost never the most complicated ones. Your body is not looking for complexity. It is looking for the right conditions to clear what does not belong and build what does. And here is what genuinely stays with me as a physician. Every single one of these 5 foods works through the same fundamental mechanism, reducing the burden on your liver and reducing the chronic inflammation that silently accelerates every aspect of cardiovascular disease. 5 different foods, 5 different nutritional pathways, all leading to the same destination. The man I told you about at the beginning, the 71-year-old with triglycerides at 580. After that appointment, we went through all 5 of these foods together in detail. He made every change carefully and consistently over the following months, always in conversation with his cardiologist, always with full medical oversight. 6 months later, he came back for his follow-up. His triglycerides were at 210, down from 580. His cardiologist reduced his statin dosage by half. His inflammatory markers had dropped to the lowest levels they had been in years. He looked different. He moved differently. And the first thing he said when he sat down across from me was, "Why did nobody tell me this sooner?" That question stays with me. It is part of why I make videos like this one. The research exists. The evidence is solid. But somewhere between the laboratory and the doctor's 15-minute appointment and the patient sitting at their kitchen table, it gets lost. You are sitting at that kitchen table right now, and you have everything you need to start tonight. Let me say all 5 one more time clearly. 1. Rolled oats every morning, 1.5 cups cooked with ground flaxseed stirred in. 2. Fatty fish 2 to 3 times per week. Salmon, sardines, mackerel, herring. 3. Extra virgin olive oil, replacing every refined vegetable oil in your kitchen. 4. 2 tablespoons of ground flaxseed daily in your oatmeal, yogurt, or smoothie. 5. 30 grams of walnuts every day. 14 halves, a small closed fist. That is it. No exotic supplements, no expensive equipment, nothing that requires a prescription. Just 5 foods that your liver has been waiting for you to give it. Here is what I want you to do right now before you close this video. Pick one. Not all 5. Just the one that feels most manageable for you tonight. Maybe it is the oatmeal tomorrow morning. Maybe it is buying sardines this week. Maybe it is checking what oils are in your kitchen right now. Just one. Start there. Because sustainable change does not come from doing everything at once and burning out in 2 weeks. It comes from one decision, repeated consistently until it becomes invisible, until it is simply the way you live. I have seen this work. Not in theory. In real people in their 60s and 70s and 80s who decided it was not too late to give their body better tools. It is never too late. Your liver is remarkably responsive. Your blood fat levels are not a fixed sentence. They are a reflection of what you have been giving your body. Change what you give it, and the numbers will follow. Which of these 5 are you going to start with? Tell me in the comments right now. I read every single one. And if this video gave you something useful, something you are going to actually use, please share it. There are people in your life right now managing high triglycerides who have no idea that food can do this. That one share might matter more than you realize. If you have not subscribed yet, please do. Every week I bring you honest, evidence-based information that I wish every one of my patients had access to long before they needed a prescription. Everything I have shared today is general medical information based on published research and clinical experience. It is not a replacement for your personal medical care. Please do not stop or reduce any prescribed medication without speaking with your doctor first. Bring this information to your next appointment. Have the conversation. Your doctor is your partner in this. And these 5 foods work best when they work alongside proper medical supervision. This is Dr. Marcus T. Thorne. Your liver has been working for you every single day without asking for anything in return. Tonight, give it something back. I will see you soon.